Abdul. Abdul Agukoh will be our first. Abdul, you can come in front because you're first one. The second person who is going to speak is our representatives from the students. I usually say, I know you guys say that the children eat after the elders, the millennials and the XYZ generation, we've toppled that up, so we speak first. Andrew Were, please prepare to speak, and then we will go to the Kenya National Union of Nurses, and then we'll do Aisha, who will speak for the community CUH. Abdul. Assalamu alaikum.
Walaikum salam. Good morning. Thank you so much to KMPDU, Amnesty, and all stakeholders. It's such a great opportunity for us to have this conversation as stakeholders, and we are at such a critical moment, especially with electioneering and COVID-19. COVID-19 really exposed our health system, which is really weak, but this gave us an opportunity as the public and citizenry in terms of us having a conversation with the government and ensuring that we're able to inform the government that universal health coverage cannot be achieved through private health solutions. Currently, we do have about 24.6 million vaccines in the country, and out of these, almost half has been utilized, compared to the other countries in the developed world, where about more than 65% have already been vaccinated. I think that this calls for a sensitization and discussion, especially with regards to vaccine hesitancy, and the government of Kenya hasn't really helped with regards to its militancy approach in as far as threatening individuals to go for vaccination. Vaccination should be a conversation. We as Christian Aid are collaborating with different partners and stakeholders through a vaccine campaign that will enable various individuals to really discuss on the supply, access, and uptake of safe, effective, and affordable COVID-19 vaccines. We call upon all stakeholders, especially the health stakeholders, to engage collaboratively in financing, planning, implementing, and monitoring health. Let us engage and find public solutions to public problems. Although the COVID-19 pandemic has taken a toll on us, the flip side is that we do have an opportunity for stakeholders to really advocate for a healthier, safe, and fairer future. The Abuja Declaration stated that we committed, as Kenya's government committed to about 15% of its national budget towards health. This hasn't been achieved. Although with devolution there has been some progress towards attaining about 7%, we are still way behind in terms of achieving these. We call upon investment towards the health sector so that we are able to mitigate issues of pandemic, and also focusing on COVID-19 doesn't necessarily mean that we have to leave the other sectors behind. With those few remarks, I really thank you, and I believe that we can and we must seize this moment together. Thank you.
Shukran, Abdul.